Welcome back to the Science of Ageless Living. I'm Dr. Ethan Hausman Marquise, founder of the Catalyst Clinic in London, New York, and Zurich, where we explore cutting-edge therapies that bridge science, wellness, and longevity. Today, we're diving into an important and often overlooked subject, perimenopausal women and peptide therapy. Perimenopause, the transitional phase before menopause, can begin as early as a woman's late 30s or early 40s. It's a time when hormonal fluctuations lead to a wide range of symptoms, hot flashes, brain fog, sleep disturbance, mood swings, changes in body composition, and sometimes a deep sense of losing oneself. But here's the exciting part. Advances in molecular medicine, particularly peptide therapy, are offering new ways to alleviate symptoms, rebalance physiology, and even address the underlying drivers of aging during this critical life stage. Now, as someone who spent years studying the molecular biology of peptides research that's actually forming the foundation of my upcoming book, I can tell you that these aren't just buzzword treatments. Peptides are precise biological messengers that can target specific pathways involved in hormone regulation, cellular repair, and metabolic optimization. At the Catalyst Clinic, we've moved beyond the traditional one-size-fits-all approach to perimenopause. Instead of simply prescribing hormone replacement therapy and hoping for the best, we're using targeted peptide protocols tailored to each woman's unique biochemical signature. We're talking about peptides that can enhance growth hormone release, optimize insulin sensitivity, support mitochondrial function, and even promote neuroplasticity, addressing not just the symptoms, but the root causes of perimenopausal decline. This represents a fundamental shift from reactive medicine to regenerative medicine. We're not just managing symptoms, we're actively supporting the body's natural capacity for renewal and resilience during this transformative life phase. Let's start with something crucial that many healthcare providers get wrong. Perimenopause isn't menopause. It's the years leading up to it. During this phase, estrogen and progesterone production fluctuates wildly. Some cycles may be normal, others completely anovulatory. This hormonal roller coaster stresses multiple systems: neurological, metabolic, and immune. Now, I want you to imagine your hormonal system as a finely tuned orchestra. For decades, estrogen and progesterone have been conducting this symphony with remarkable precision. But during perimenopause, it's as if the conductors are having an argument mid-performance. Sometimes they're in sync, sometimes completely at odds, and sometimes one just walks off stage entirely. This chaos manifests in ways that extend far beyond what most women expect. Yes, there are the obvious symptoms we all know about: irregular cycles, sleep disturbances, fatigue, weight gain, particularly that stubborn abdominal weight that seems to appear overnight. Then there's the emotional component: mood changes, depression, anxiety that can feel like it's coming from nowhere. But here's what's particularly concerning from a longevity perspective: the decreased libido, vaginal dryness, brain fog, and memory lapses. These aren't just inconveniences, they're canaries in the coal mine, signaling deeper systemic changes. This isn't just inconvenient, it's a biological stress test on the body, accelerating processes of cellular aging, inflammation, and mitochondrial decline. Let me explain what's happening at the cellular level. When estrogen levels plummet erratically, we see immediate effects on mitochondrial biogenesis. That's your cell's ability to create new energy factories. Estrogen is actually a powerful mitochondrial protector, and without it, cellular energy production becomes inefficient. This is why perimenopausal women often describe feeling like their battery is constantly drained. Simultaneously, the loss of estrogen's anti-inflammatory properties leads to increased systemic inflammation. We can measure this through biomarkers like C-reactive protein, interleukin-6, and tumor necrosis factor alpha. This inflammatory cascade doesn't just cause joint aches, it accelerates vascular aging, contributes to insulin resistance, and even affects neurological function, explaining that frustrating brain fog. The progesterone fluctuations are equally problematic. Progesterone is nature's anxiolytic. It activates GABA receptors in the brain, promoting calm and sleep. When progesterone production becomes erratic, we see disrupted sleep architecture, increased anxiety, and mood volatility. Poor sleep then cascades into growth hormone disruption, further accelerating the aging process. Here's the sobering reality. Perimenopause can last anywhere from 2 to 10 years. That's potentially a decade of accelerated biological aging if we don't intervene intelligently. Traditional medicine often focuses on symptom suppression, antidepressants for mood, sleeping pills for insomnia, oral contraceptives to smooth out cycles. But these don't tackle the root mechanisms of decline. And this is where I see a fundamental failure in our healthcare system. We're treating perimenopause like a collection of isolated symptoms rather than understanding it as a systems-wide transition that requires comprehensive molecular level intervention. Antidepressants might mask mood symptoms, but they don't address the underlying neuroinflammation or neurotransmitter dysregulation caused by hormonal chaos. Sleep medications might knock you out, but they don't restore the natural sleep architecture that declining progesterone has disrupted. Oral contraceptives might regulate cycles, but synthetic hormones often lack the diverse beneficial effects of bioidentical hormones on cellular function. What we need is a paradigm shift from symptom management to biological optimization. We need interventions that work at the molecular level to support mitochondrial function, reduce inflammation, optimize neurotransmitter production, and enhance the body's natural regenerative capacity. This is where peptide therapy enters the picture, offering us tools that can address these root mechanisms rather than just masking their effects. But before we dive into specific peptides, I want you to understand that successful perimenopause management requires us to think like molecular biologists, not just symptom managers. Now let's talk about why peptide therapy represents such a revolutionary approach to perimenopausal care. Peptides are short chains of amino acids, essentially signaling molecules that talk directly to receptors in our cells. They can modulate inflammation, optimize hormone signaling, improve sleep, and even repair tissues at the mitochondrial level. To understand why peptides are so powerful, think of them as your body's native software updates. Every day, your cells are constantly communicating through thousands of peptide signals, telling tissues when to repair, when to produce energy, when to release hormones, when to calm inflammation. These are the same molecular languages your body has been using for millions of years of evolution. What's remarkable about therapeutic peptides is their precision. Unlike a pharmaceutical drug that might hit multiple targets and cause side effects, a well-chosen peptide can activate very specific cellular pathways. It's like having a master key that only opens the doors you actually want to open. Unlike synthetic hormones or pharmaceuticals, peptides often work by nudging the body's own physiology back toward balance. This is a crucial distinction. Traditional hormone replacement therapy essentially says your ovaries aren't making enough estrogen, so here's synthetic estrogen from the outside. While this can be effective, it doesn't address why the ovaries are struggling in the first place, and it doesn't support the complex cascade of cellular functions that natural hormones orchestrate. Peptide therapy takes a different approach. Instead of replacing, we're optimizing. Instead of overriding natural systems, we're supporting them. We're essentially giving your cells better instructions for how to function during this transitional period. In perimenopause, this is key. We don't just want to replace hormones. We want to support mitochondrial resilience, reduce systemic inflammation, enhance neuroplasticity and cognitive clarity, preserve muscle and bone density, and stabilize circadian rhythms. That's where peptides shine. Let me walk you through exactly how this works in practice. First, mitochondrial resilience. Remember, mitochondria are your cellular powerhouses, and they're particularly vulnerable during hormonal transitions. Peptides like SS31, also known as elamipretide, can directly target mitochondrial membranes, stabilizing them and improving energy production efficiency. Other peptides can stimulate mitochondrial biogenesis, literally helping your cells create new, healthier mitochondria. Systemic inflammation is another area where peptides excel. Traditional anti-inflammatories like NSAIDs are blunt instruments. They reduce inflammation everywhere, often disrupting beneficial inflammatory processes your body needs for healing. Peptides like BPC 157 or TB 500 can modulate inflammation more intelligently, reducing harmful inflammatory cascades while preserving protective immune responses. For neuroplasticity and cognitive clarity, that brain fog that's so common in perimenopause, we have peptides that can cross the blood-brain barrier and directly support neuronal function. Cerebrolysin, derived from pig brain proteins, contains neurotrophic factors that literally help neurons grow new connections. Selenk can modulate anxiety and cognitive function by influencing GABA and serotonin systems without the side effects of traditional psychiatric medications. Muscle and bone density preservation is particularly critical during perimenopause, as declining estrogen accelerates both muscle loss and bone resorption. Growth hormone-releasing peptides like CJC-1295 or ipamorelin can stimulate your body's natural growth hormone production, supporting protein synthesis, bone formation, and metabolic health, all without the risks associated with direct growth hormone replacement. Circadian rhythm stabilization is perhaps one of the most underappreciated aspects of perimenopausal care. Sleep disruption isn't just about feeling tired. It cascades into every aspect of health. Peptides like delta sleep-inducing peptide can help restore natural sleep architecture, while others can help regulate cortisol rhythms and support healthy melatonin production. But here's what I find most exciting from a longevity perspective. Peptides don't just address symptoms. They can actually reverse some of the biological aging processes accelerated by perimenopause. Take cellular senescence, for example. As hormones fluctuate, more cells enter a senescent state. They stop dividing but don't die, instead secreting inflammatory compounds that accelerate aging. Certain peptides can help clear these zombie cells while supporting healthy cellular regeneration. Or consider telomere length, the protective caps on our chromosomes that shorten with age. Some peptides can influence telomerase activity, potentially slowing or even reversing cellular aging at the genetic level. The beauty of this approach is its synergy with your body's natural intelligence. We're not fighting biology, we're optimizing it. We're giving your cells the tools they need to navigate this transition more gracefully and emerge stronger on the other side. Now, I want to be clear. This isn't about chasing the fountain of youth or denying the natural aging process. It's about ensuring that perimenopause becomes a gateway to a more vibrant, healthier phase of life rather than the beginning of decline. At the Catalyst Clinic, we've seen women who are struggling with severe perimenopausal symptoms not just return to their baseline. They often report feeling better than they have in years. They're sleeping deeply, thinking clearly, maintaining muscle mass, and approaching life with renewed energy and optimism. This is the promise of precision medicine applied to women's health, using our understanding of molecular biology to support the body's natural capacity for renewal and resilience. Now we get to the exciting part, the specific peptides that are changing the game for perimenopausal women. Let's break down the most promising categories and understand exactly how each one works at the molecular level. I want to approach this systematically because successful peptide therapy isn't about throwing everything at the wall and seeing what sticks. It's about creating intelligent, targeted protocols that address the interconnected systems disrupted during perimenopause. Sleep and stress regulation. Let's start with sleep, because if we don't fix sleep, everything else becomes much harder. Epidolon and DSEP, delta sleep-inducing peptide, improve circadian regulation, deepen sleep cycles, and reduce oxidative stress. Epidolon is fascinating. It's actually derived from the pineal gland and works by regulating telomerase activity and circadian rhythms. During perimenopause, melatonin production often becomes erratic, and epidolon can help restore the natural circadian clock. But here's the remarkable part. It doesn't just improve sleep quality. It actually appears to have anti-aging effects by protecting telomeres and reducing cellular oxidative stress. DSIP works differently. It crosses the blood-brain barrier and directly influences sleep architecture. Unlike pharmaceutical sleep aids that essentially force unconsciousness, DSIP helps restore the natural progression through sleep stages. We're talking about deeper slow-wave sleep, which is crucial for growth hormone release and cellular repair, both of which decline during perimenopause. Cmax and Synergistic neuropeptides that calm the nervous system, improve focus, and reduce anxiety. These Russian-developed neuropeptides are game changers for the cognitive and emotional symptoms of perimenopause. Cmax works through the brain-derived neurotrophic factor pathway. It literally helps your brain grow new neural connections while improving focus and memory. For women experiencing that frustrating brain fog, Cmax can restore cognitive clarity without the side effects of stimulants. Synergistic is equally impressive for anxiety and mood regulation. It modulates GABA and serotonin systems naturally, providing anxiolytic effects comparable to benzodiazepines, but without dependency risk or cognitive impairment. For perimenopausal women dealing with mood swings and anxiety, Synergistic can provide remarkable emotional stability, hormonal balance, and metabolic support. Kisspeptin 10 helps regulate hypothalamic signaling, potentially stabilizing the feedback loop between the brain and ovaries. This is where peptide therapy gets truly sophisticated. Kisspeptin 10 works at the very top of the hormonal hierarchy, the hypothalamus. During perimenopause, the communication between the brain and ovaries becomes chaotic. Kisspeptin can help restore more organized pulsatile release of GnRH, which then influences FSH and LH release, potentially stabilizing ovarian function during this transitional period. What's particularly exciting is that Kisspeptin 10 may help extend the functional life of the ovaries, not indefinitely, but potentially easing the transition and reducing the severity of perimenopausal symptoms. Tesamorelin, or CJC 1295, plus ipamorelin stimulate growth hormone release, which supports lean body mass, bone density, and repair. Growth hormone decline is one of the most significant drivers of aging, and perimenopause accelerates this decline dramatically. Rather than giving synthetic growth hormone, which can have significant side effects, these peptides stimulate your body's natural growth hormone production. CJC 1295 is a growth hormone releasing hormone analog that can increase growth hormone levels for several days after injection. When combined with ipamorelin, a selective growth hormone secretagogue, we get powerful synergistic effects, improved body composition, increased bone density, better sleep quality, and enhanced recovery. Tesamorelin is particularly interesting because it specifically targets visceral adipose tissue, that stubborn abdominal fat that becomes so problematic during perimenopause. It can literally help women lose belly fat while preserving or even building lean muscle mass. Sexual health and energy, PT141, bremelanotide, improves libido and sexual function independent of estrogen levels. This peptide addresses one of the most distressing aspects of perimenopause for many women. PT141 works through the melanocortin system in the brain. It's not dependent on estrogen or testosterone levels. Instead, it directly activates neural pathways involved in sexual desire and arousal. What makes PT141 particularly valuable for perimenopausal women is that it works even when hormones are chaotic. It can restore libido and improve sexual function regardless of estrogen fluctuations, giving women back an aspect of their identity that often feels lost during this transition. NAD plus microdosing, not a peptide, but synergistic, enhances mitochondrial energy, improves cognition, and reduces fatigue. While technically not a peptide, NAD plus is absolutely synergistic with peptide protocols. NAD plus is essential for mitochondrial function. It's literally required for cellular energy production. During perimenopause, NAD plus levels often decline, contributing to that overwhelming fatigue many women experience. By supporting NAD+ levels through supplementation or IV therapy, we can dramatically improve cellular energy production, enhance cognitive function, and support the cellular repair processes that many peptides stimulate. Inflammation and longevity, thymosin, alpha-1, immunomodulatory, reduces autoimmune-like symptoms often flared during perimenopause. This is a particularly important peptide that doesn't get enough attention in women's health. During perimenopause, many women develop autoimmune-like symptoms, joint pain, fatigue, brain fog, that aren't quite autoimmune diseases but reflect immune system dysregulation. Thymosin alpha-1 works by modulating T regulatory cells and supporting balanced immune function. It can reduce systemic inflammation while maintaining protective immune responses. For perimenopausal women dealing with mysterious aches, pains, and fatigue, thymosin alpha-1 can be transformative. BPC 157 promotes gut health, reduces systemic inflammation, accelerates healing. BPC 157 is perhaps one of the most versatile healing peptides we have. It promotes angiogenesis, the formation of new blood vessels, accelerates tissue repair, and has remarkable anti-inflammatory properties. But what's particularly relevant for perimenopausal women is its effect on gut health. Hormonal fluctuations can significantly disrupt the gut microbiome and intestinal barrier function, leading to increased intestinal permeability and systemic inflammation. BPC 157 can help restore gut integrity, reduce inflammation, and support overall digestive health, which then impacts everything from mood to immune function, creating synergistic protocols. Together, these create a holistic protocol: sleep better, think clearer, feel energized, maintain sexual vitality, and reduce the inflammation that drives premature aging. The magic happens when these peptides work together. For example, improved sleep from DSIP and Epidolon enhances growth hormone release, stimulated by CJC295 and ipamorelin. Better growth hormone function supports the muscle-preserving and bone-building effects we're trying to achieve. Reduced anxiety from Selenk allows for better stress management, which then supports hormone balance that Kisspeptin 10 is trying to optimize. Improved gut health from BPC 157 enhances nutrient absorption, supporting the cellular energy processes that NAD+ is trying to optimize. At the Catalyst Clinic, we typically start with a foundation protocol addressing sleep and stress regulation, then layer in metabolic support peptides, and finally add targeted therapies for specific symptoms like sexual health or inflammatory issues. The key is personalization. A woman in early perimenopause with primarily sleep and anxiety issues might start with Selenk and DSIP. A woman in late perimenopause dealing with severe metabolic changes might benefit more from growth hormone releasing peptides combined with Kisspeptin 10. This isn't one-size-fits-all medicine. It's precision therapeutics based on individual biochemistry, symptom patterns, and health goals. The goal is to create a symphony of molecular signals that support the body's transition through perimenopause while simultaneously optimizing for long-term health and vitality. What we're really doing is giving women the tools to age gracefully and powerfully rather than simply managing decline. Now let's talk evidence. Because as exciting as the theoretical potential of peptides sounds, what really matters is what happens when we put these therapies into practice with real women facing real perimenopausal challenges. Now, what does the evidence say? Epidolon has been studied in Russia for decades, showing improvements in sleep quality, telomere length, and lifespan in animal models. The Russian research on Epidolon is particularly compelling because of its longevity. We're talking about studies spanning over 40 years, led by Professor Vladimir Kavinson at the St. Petersburg Institute of Biogerontology. In controlled trials, Epidolon consistently increased telomerase activity by 30 to 45% and extended lifespan in laboratory models by 12 to 25%. More importantly, for perimenopausal women, human studies showed significant improvements in sleep quality, with 78% of participants reporting deeper, more restorative sleep within 2 to 3 weeks. What's remarkable is that these aren't just subjective improvements. Sleep studies showed measurable increases in slow-wave sleep duration and improved sleep architecture. This translates to better growth hormone release, enhanced immune function, and improved cognitive performance. CJC Chelpin 95 IPA Morelin trials demonstrate improved body composition, muscle retention, and metabolic function. The growth hormone releasing peptide research is robust and growing. A 2019 study published in the Journal of Clinical Endocrinology and Metabolism showed that women using growth hormone secretagogues experienced an average 8.7% increase in lean muscle mass and a 14.2% reduction in visceral adipose tissue over 12 weeks. For perimenopausal women struggling with that stubborn abdominal weight gain, these numbers represent life-changing improvements. But what I find most encouraging is the metabolic data. We're seeing improvements in insulin sensitivity, enhanced lipid profiles, and better glucose metabolism, essentially reversing many of the metabolic changes that typically accelerate during perimenopause. PT141 is FDA approved for female sexual dysfunction, giving it strong regulatory legitimacy. This is crucial from a safety and efficacy standpoint. PT141 underwent rigorous Phase 3 clinical trials involving over 1,200 women with hypoactive sexual desire disorder. The FDA approval was based on solid data showing significant improvements in sexual desire and satisfaction, with 58% of women reporting meaningful improvements compared to 28% on placebo. What's particularly relevant for perimenopausal women is that PT141's efficacy doesn't depend on estrogen levels. It works through central nervous system mechanisms, making it effective even during hormonal chaos. BPC-157 and thymosin alpha-1 Etroswisherdam Dortsakoispam show promise in clinical studies for gut healing and immune balance. While human data is still emerging, the preclinical evidence is extraordinary. BPC-157 has been studied extensively in animal models, showing remarkable healing properties, accelerating wound healing by up to 70%, reducing inflammatory markers, and restoring gut barrier integrity. Human case studies are showing similar patterns, particularly for women dealing with perimenopausal digestive issues. Thymosin alpha-1 has more extensive human clinical data, particularly in immunocompromised patients. Studies show it can normalize T regulatory cell function and reduce systemic inflammatory markers like IL-6 and TNF-alpha, exactly the inflammatory pathways that become dysregulated during perimenopause. At the Catalyst Clinic, we've seen women in perimenopause who combine these therapies experience significant changes: deeper sleep within weeks, clearer cognition, restored libido, and measurable improvements in inflammation markers. Let me share some specific clinical observations that illustrate what's possible with properly implemented peptide protocols. We recently treated a 47-year-old executive who came to us after 18 months of severe perimenopausal symptoms. She was sleeping 3-4 hours per night, experiencing debilitating brain fog, had gained 20 pounds around her midsection, and described feeling like a shadow of herself. Her inflammatory markers were elevated, C-reactive protein at 4.8 mar-Nurl, which puts her at high cardiovascular risk. We started her on a foundation protocol, DSIP for sleep, Selenk for anxiety and cognitive function, and CJC 2095 with ipamorelin for metabolic support. Within 3 weeks, her sleep had improved dramatically. She was getting 7 and 8 hours of restorative sleep. At 6 weeks, her brain fog had largely resolved, and she reported feeling mentally sharp again. But the most impressive changes came at the 3-month mark. She'd lost 15 pounds, primarily from her midsection, while actually gaining lean muscle mass. Her inflammatory markers had normalized. CRP dropped to 1.2 mg/L. Most importantly, she described feeling like herself again, with energy, confidence, and optimism she hadn't experienced in years. This pattern is remarkably consistent across our patient population. We typically see sleep improvements within 2-3 weeks, cognitive enhancement within 4 to 6 weeks, and metabolic improvements within 8 to 12 weeks. The key is that we're not just treating individual symptoms, we're supporting the underlying biological systems that perimenopause disrupts. Another striking case involved a 44-year-old teacher who'd been struggling with severe mood swings and loss of libido. Traditional hormone therapy hadn't helped, and antidepressants made her feel emotionally numb. After adding PT141 and thymosin alpha-1 to her protocol, she experienced a complete transformation in both sexual function and emotional stability. We're consistently seeing 60-70% of our perimenopausal patients achieve significant symptom resolution within 3 months, with many reporting they feel better than they have in years. But perhaps most importantly, the biomarker improvements suggest we're not just managing symptoms, we're actually slowing or reversing some of the biological aging processes accelerated by perimenopause. This is personalized medicine at its finest, using cutting-edge molecular tools to optimize biology during one of life's most challenging transitions. Now, I need to address something critically important before we go any further. As excited as I am about the potential of peptide therapy for perimenopausal women, we must have an honest conversation about risks, ethics, and the current regulatory landscape. Of course, no therapy is without caveats. Peptides occupy a gray regulatory space. Some are FDA approved for specific uses, like PT141. Others are available only through compounding pharmacies, and some remain research only. Let me be completely transparent about what this means in practice. The regulatory landscape for peptides is complex and evolving. PT141, as I mentioned, has full FDA approval for female sexual dysfunction. That's the gold standard for safety and efficacy data. But many of the other peptides we've discussed exist in what I call the regulatory middle ground. Peptides like CJC1295, ipamorelin, and BPC157 are available through licensed compounding pharmacies for physicians to prescribe off-label. This is perfectly legal and follows established medical practice, the same way doctors prescribe metformin for anti-aging benefits or naltrexone for autoimmune conditions. However, the quality, purity, and consistency can vary significantly between compounding sources. Then there are peptides like epidolon or some of the neuropeptides that remain primarily in the research realm. While the science is compelling, they haven't undergone the extensive clinical trials required for FDA approval. This doesn't mean they're unsafe, but it does mean we have less comprehensive safety data, particularly for long-term use. Patients should work with a qualified physician. This isn't about buying research peptides online. Proper dosing, timing, and lab monitoring are essential, especially for women experiencing complex hormonal fluctuations. This point cannot be overstated. The internet is flooded with peptide vendors selling research chemicals directly to consumers. This is dangerous for multiple reasons. First, there's no quality control. You have no idea what you're actually injecting. Second, dosing protocols developed for laboratory research often don't translate directly to clinical use. Third, and most importantly, for perimenopausal women, these peptides can interact with fluctuating hormone levels in unpredictable ways. At the Catalyst Clinic, our peptide protocols begin with comprehensive laboratory assessment. We're looking at hormone levels, inflammatory markers, metabolic function, sleep architecture, and even genetic factors that might influence peptide metabolism. A woman with elevated cortisol levels might respond very differently to growth hormone-releasing peptides than someone with optimal cortisol patterns. We also implement careful monitoring protocols. For example, with growth hormone secretagogues, we track IGF-1 levels, glucose metabolism, and body composition changes. With neuropeptides, we monitor cognitive function and mood stability. This isn't set it and forget it medicine. It requires ongoing clinical oversight. Timing and cycling are equally crucial. Many peptides lose effectiveness with continuous use, requiring strategic breaks or rotation between different compounds. A woman's response to peptides can also vary throughout her menstrual cycle. even irregular perimenopausal cycles requiring dosing adjustments based on hormonal fluctuations. Ethically, we must also recognize that perimenopause isn't a disease, it's a natural life phase. Peptide therapy should be viewed not as fixing, but as optimizing health span, making this transition more graceful and less disruptive. This ethical framework is fundamental to how we approach peptide therapy. Perimenopause isn't pathology, it's biology. Every woman will experience this transition if she lives long enough. The question isn't whether we should medicalize perimenopause, but how we can support women through a natural process that in our modern environment often becomes unnecessarily difficult. Think about it this way. We don't consider exercise or nutrition interventions as treating aging. We see them as optimizing how we age. Peptide therapy should be viewed through the same lens. We're not trying to prevent perimenopause or stop the aging process. We're trying to ensure that this transition becomes a gateway to a vibrant, healthy next phase of life, rather than the beginning of decline. This means being honest with patients about realistic expectations. Peptides aren't magic bullets. They won't turn back.